As more states roll out their plans and businesses work to safely reopen, one entity that is seemingly absent from the entire conversation is the Occupational Safety and Health Administration, better known as OSHA. That's the federal arm that is tasked with making sure that employers are keeping their employees safe. Should OSHA have a more aggressive role in setting standards for workplaces to reopen safely, or should this ultimately be left in the hands of state governments and businesses? Joining us now is the former head of OSHA during the Obama administration, Dr. David Michaels. Doctor, thanks so much for joining us tonight.
Thank you so much for having me on the show.
So what's your biggest concern right now as states are reopening? Is enough being done to make sure that workers will be protected as they head back to their jobs, and for those essential workers who have stayed on the job?
Absolutely not. Look, COVID-19 has become a massive worker safety crisis, and worker safety is the fulcrum which is going to determine whether or not we can open up the economy safely, or if we'll have thousands more deaths and have to close it back up again. What we need are strong federal rules. You know, OSHA, the agency I ran, and the CDC have been putting out recommendations, but they're just recommendations, they're suggestions, they're not rules. And the proof that rules are needed, the recommendations don't work, are the 10,000 workers in meat and poultry plants who've become infected with the coronavirus. Those companies knew those suggestions were out there and they ignored them. What we need to see is an emergency standard that says every employer has to develop a plan to protect workers from this exposure. OSHA and the Department of Labor have said they won't do that. Congress is now considering legislation to require OSHA to do that. That's H.R. 6559. I hope that passes. If not, it'll be on the states. Some governors have said they'll do that, but it's got to be more than just state by state. We need a federal approach to this problem.
And you've advocated for firm guidelines from OSHA. How would a blanket set of rules work when the scenario we see in New York State, for example, is not the same that we see in other places like Montana? Why aren't the CDC and OSHA recommendations enough?
Because they're recommendations. They say this is what you should do, and they have lots of ways that employers can decide not to do that. Employers need more than just firm guidance. They need a rule. They need the government to say, you must do this. What I'd like to see is every employer sit down with their workers, figure out how are we going to make sure everybody's protected, because workers have a role in this too. They've got to take some responsibility and they have to buy into it. But when employers and workers sit down, they look at the recommendations that OSHA puts out, they can embrace those. They can say, this is how we're going to do it. This is how we're going to make it work. This is how we can work safely and not get sick. That's the only way it's going to work. But it's not specific. OSHA is not saying you must do it exactly this way. It has some very, very good guidance, but that guidance has to be followed by employers.
And I'm curious also, why doesn't OSHA already have a standard for airborne infectious disease? I mean, that's something that you worked on during your time in the last administration.
That's right. We started putting a standard together after the H1N1 epidemic, where we saw this was badly needed. We were working on that when I left in January 2017. It was on the table, ready to move forward. The Trump administration came in and they announced no more new regulations and let's stop work on everything that you're doing that could better protect workers. And so it's been sitting in a drawer for 40 months now. It could be out. It could be out there protecting workers. It could be out there telling employers what they need to do. But this is just one more reason the Trump administration has really abandoned any sort of commitment to working people in the United States.
Well, many essential workers have been hit with infections, including, as you know, those at meat packing plants where we've seen large spikes in cases. How concerned are you about the conditions at those plants as they reopen, and what additional measures need to be taken to protect those frontline workers?
Well, look, first of all, it is too late for many of those workers. They're exposed. I haven't seen what's been going on in every one of those plants. I know that some of the employers are very committed to doing it right, and others aren't. The problem is there is no requirement that they do it right. The Trump administration is saying, pedal to the metal, produce as many, steaks, cut chickens as you can, and if workers are hurt along the way, well, so what? That's wrong. We need to be slowing down the line. We need to be making sure every worker is safe, not only in meat and poultry plants, but as we reopen the economy in every sort of industry. If we don't protect workers, it's really going to be a disaster because workers and worker infections will drive this epidemic forward.
Right.
We need to stop that.
I saw a headline today, I think, that said something about what do you value more, the pork chop or the people? But lastly, I want to get at your concerns around the issue of liability protections for businesses. Could we see workers suing businesses if they get sick without those types of protections?
It's very difficult in any state of this country for a worker to sue their employer because workers' compensation prohibits workers from suing their employer. But giving employers liability protection is like giving them a free pass. It's saying, you know, you can do whatever you want because OSHA has said it's not going to issue a standard. OSHA has said it's not going to inspect. So what is there to stop an employer from just exposing workers to all sorts of hazards? Liability protection, I think, would be a big mistake and really make it difficult to reopen the country because workers are going to be very scared to go back in.
Dr. Michaels, thank you so much for your time and your insight tonight. We appreciate it.
Sure.
We should also point out that current OSHA leaders have declined interview requests from ABC News to talk about COVID-related enforcement and complaints.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.